pediatric health assessment is very important. So if you're taking the NCLEX, at least you should know something about it. The NCLEX like to ask questions on vulnerable patients, elderly. That's why they ask you Alzheimer's disease, older patients. Peds are very important. Kids, neonates, young adults, yeah, they are all vulnerable. So let's do some quick practice questions. Just our concept. Most of these questions will be concepts. So that's what you should pay attention to. So this is a question. First question. Only one concept, okay, and test taking strategy. Which of the following action indicate correct understanding? Correct understanding. And nurse is performing a year exams for a 11-year-old client. Which action is correct? You put the pinna down and back, or sideways and back, or sideways and up, or up and back. Like I said, concept. You know the concept to answer this question? Try it. Try it. What do you think the answer is? One concept. If I'm taking the test, this is the way I will approach it. You have a kid and an adult. Kids are young, right? So I call it down. Adult, up, right? So if you're young, you go down. If you're adult, you go up. 11-year-old, where would you put it? 11-year-old is an old child. So it's considered an adult. Because he's 11-year-old, he's not a kid anymore. He's 11-year-old, he's an older child. So what should you do? He's going up. So up and back. One down is wrong. 11-year-old is not a kid. He's older. So he's an older adult or older child, basically. So it should be going up and back. So you have to know the age range. He's 11-year-old. He's not a kid. He's an older child. So older child should be up and back. Number 2. And nurse is teaching new graduate about the year exam on the child. Like I said, you have to master kids, child, neonate, and toddler. That's all. Don't worry about the middle people. Then you go to the old elderly patients. Those are the things you have to know for health promotion, all those things. So which of the following the nurse should include? You want to do exam on the a child year exams. This question is based on the previous one. It's our concept, and you have to know that's how you can do the exam. Are the ear canal long and straight? Is the tympanic memory red? Is the tympanic memory reddened during when they cry? Do you perform auditory testing after they go to school? Concept. What do you think? Test taking strategy, right? Why would I tell you something is long and straight? And from the first question, we said we got to do what? Up and down for older patient, and for young, we got to go what? Down, right? Up and back, and then down and back for a younger kid. There's a reason why. This is short and straight. That's why you pull your ear down and back in order to straighten it. So because it's short. So this is wrong. It's not long, it's short. The tympanic memory is not red. It's gray color. But when they cry, it turns red. So this is wrong But when they cry, it becomes red so that you can see much better. You perform your exam before they go to school. So the correct answer is number 3. The year is not long, it's short and straight. Tympanic memory is gray, and when they cry, it becomes red. And you do testing before they go to school. So the right answer is number 3. 10. Same strategy, one concept. Which of the following is appropriate? You see, they are short questions. And this is auscultating the lung of a 5-year-old client. Which one is appropriate? Keyword, listen to the lung of a 5-year-old. You put them in the prone position. You use the stethoscope bell to listen to high-pitched sound, a concept. You listen, use the diaphragm for low-pitched sound, is a concept. Do you ask them to blow a pinwheel? What do you think if you want to listen to a kid's lung? What do you think you should do? The kid will be playing around. Or you can ask them, the only way you can get a better exams is for them, their lung to be expanded. Which of this is expanding the lung? Prone position does not help you. And these two are concepts. The bell is good for low pitch. The diaphragm is good for high pitch. So this and that is wrong. Test-taking strategy, you got to pick this. Even if you don't know it, you got to. When they blow a pinhole, they make their lung bigger and you can examine them. So the way to answer questions is to look at the answers and try to pick the answers apart and then make sense out of it based on your content. You see, I come up with the content and I attack each answer choice with that. If there's a concept, I attack it. So 4 is your right answer. Next question. So next is assessing 5-year-old client on what? The Jackson apical pulse. When you assess the kid apical pulse, which of the following location the nurse should assess for this pulse? Left 5th intercostal space, left 4th intercostal space, right 2nd intercostal space, right 5th intercostal space. It look intimidating, but break it down. I intentionally said it that way. 5-year-old, I want to check apical pulse. All you need to do, ask yourself, where is the apical pulse in people? In older people, it's always on the left. Your heart is on the left. That's where the macho valve, that's where you're going. And test-taking strategy, you got to eliminate right and right because you know the apical pulse will be on the left. The heart is displaced to the left. Strategy to answer questions. So you don't look at the number 3 and 4. So you have 50-50 chance of 1 and 2. Then you ask yourself, why did they give me 5-year-old? Because in adult, you go to the 5th intercostal space. As they're young, the heart is close to the middle, and then when they get bigger, it displays more laterally and down. So adult 5th intercostal space, child 4th intercostal space. Therefore, this is your right answer. There's a reason why I give you 5-year-old. Strategy to attack NCLEX questions. You have to understand that, hey, adult, I check 5. So why would I pick 5 for a 5-year-old? No, that's the examiner telling you, yeah, you should be thinking. I give you 5-year-old, you shouldn't think, pick an answer that is good for adult. This one is for an adult. And you eliminate this because you know it's on the left side. Try it. It will work really hard for you. You do well in your Q banks. in your test. Another good question. Which of the following the nurse should include to test for strabismus? A nurse is teaching new graduate about strabismus. If you don't know what strabismus is, what it means, at least you've heard it, and you know this involves your eyes, right? Did you use rain test, Snelling test, Weber test, cover and uncover? Look at the way I'm going to approach it. You know that something is related to your eyes. Therefore, I'm not going to pick a test that does not relate to my eyes. I know this rain test and Weber, they're related to your ears. It's a test for your ears. They use in balancing and ear sound and figure out conduction and hearing problem. Therefore, I'm left with what? 2 and 4. And you know, somebody who has strabismus, you don't need to do visual acuity test on them. You're not looking for their 20/20 vision, 20/100 vision, 20/40 vision. You want to know which eye is weak or strong. It's an alignment problem. It's an alignment. You see what I'm trying to do? Content, an alignment problem. How do you check an alignment? By letting them read a chart? No. You cover one eye and see which eye is naked. So you have this eye here and this. So if you cover this, you examine this. You cover this and you examine this. Therefore, Snelling test is not the right answer. It's cover and uncover. Just breaking down the question. Okay? Any answers? Same thing here. Which of the following the nurse should recommend to be measured first? The nurse is teaching new graduate on how to assess a new infant. New infant. Which one? Temperature, blood pressure, respiration, saturation. You ask yourself, why would the examiner ask me this kind of question? Because there's a content there. There's a concept. What is the concept? To do exams on the kid, you go for what? Least invasive. Which of this is least invasive? Measuring their temperature, checking their blood pressure, checking their respiratory rate, checking their saturation. Which one is least invasive? The most least invasive is you're not touching them. That's the way I underline it. I'm not touching, no touching. It's just observation. Or if I'm touching you, it's light touching. If I have to check your temperature, I got to put something in your mouth or in your rectum or your armpit. Wrong. I got to put a blood pressure cuff on you, squeeze it. You don't like it. Respiration, you can just look at them, check how much they do belly breathing, abdominal breathing, and you can count. And you can find out how much their respiratory rate. Saturation, you got to put the probe on them. So respiration is your answer. I'm just trying to get you guys thinking. Simple, straightforward question, right? That's NCLEX type of question. This is the same thing. This is based on the same question, same concept. And look at it. Which of the following the nurse should perform first? A nurse is assessing a 1-year-old client who is sleeping comfortably, right? Which one do you do? Moral reflex, palpation of the abdomen, auscultate their heart and lung, or do a visual acuity? Think about it. Look, if you heard what I said for question 6, then this question should be easy. If you see, when I ask questions, I go back and forth to instill the concept in you. So 6 and 7 are the same thing, but different form. 6 and 7 are the same thing, but different answer choices. So use the same concept to answer it. Use the same concept. What did I say? To examine a kid, go with the what? Least invasive. Which of this is the least invasive? Which of this is the least invasive? That's all. You want to drop this kid, he's sleeping. Don't touch him. He doesn't want to be bothered. If you bothered him, he's going to cry. You can't get your exams. If you do Monroe reflex, he's not going to be happy. If you poke on his belly, abdomen, he's not going to be happy. So, least invasive. You want him to read a chart, to look at his visual acuity. He's sleeping. If you can sleep, I can measure your heart sound and then your lung sound without any problem. So least invasive is that one, number 3. Of course, you got to know these numbers. You have to know this. The UAP provided the following values for a 3-year-old client to the nurse. Which of the following which one the nurse should notify the MD? I think those that, when it comes to vital signs, I told you vulnerable and non-vulnerable. For the vulnerable, neonate, okay, infant, and a toddler are your key. And the way I remember them, I take the infant and I use the infant as my baseline. So I know the infant, their heart rate is 110 to 160. Their respiratory rate is 30 to 60. And their blood pressure is like 70 to 100 over 40 to 50. And this is what I do. For neonate, I know the heart rate has to be higher, the respiratory has to be higher, and blood pressure has to be lower. For the toddler, the heart rate has to be lower, respiratory has to be lower, and blood pressure has to be higher. This is my strategy in answering this neonate infant toddler question. Therefore, I look at it. Heart rate 100, and I know the infant, this guy is a toddler, so he's a toddler. If the infant is 110 to 160 and the toddler is 100, I think this is good. If the infant is 30 to 60, the toddler, it should go down. This is 55. No, I'm worried. It's in the middle of that. So this one, blood pressure 90 over 60. I expect this one to go. Toddler is 70 to 100. Therefore, 90 to 60. I like this. Saturation is normal. So the only thing that is left is this. But you can do it anyway, but don't memorize all of them, all the stages. You have to know the neonate, infant, and toddler because they are the most vulnerable people and NCLEX likely to ask questions on. So 55 is not good for them. And this is the same thing, but I changed it. I made it funny, a bunch of stuff. Which of the following is concerning? A nurse is caring for what? A 9-month-old, right? It's an infant in the pediatric ED due to what? Decreased oral intake, is vomiting, is having diarrhea. In the emergency room, he start crying, his heart rate jumped from what? 140 to 180. 5 minutes later, he's now sleeping quietly on his mother's lap. Which of the following is concerned? Breaking down. 9-month-old. He came in because oral intake has decreased, he's having diarrhea, and he's vomiting. What does this tell you? His heart rate was 140, then he went to 180. Now he's sleeping. All of a sudden, what do you think? Which one are you worried about? Because his heart rate is 180? Because he has decreased oral intake? Because his heart rate is 140? Or because he's sleeping? Which one? What do you think? Which one do you think is concerning? Prioritization. If you have to pick one, which one should you worry about? I give you the answer already away. This guy is an infant. His blood pressure, his heart rate is usually what? 110 to 160. When he cries, it goes to 180. It goes to 180. So this, I'm not worried about it. After 180, after he cry, now he's sleepy. He's been vomiting. He's not taking food. He's having diarrhea. This kid is dehydrated. Think about it. Fine, he's not eating. This was normal. I'm left with this and that. Sleepy in the kid who's been vomiting, having diarrhea, is lethargy. I don't want to give you the word lethargy, but use your critical thinking. A kid who's been vomiting, who's been having diarrhea, he cannot take any food, and all of a sudden he's sleepy, he has lethargy. This lethargy is why he's sleepy. 2 is wrong. 3 is wrong. Number 4 is your answer choice. Sleeping quietly is lethargy. And lethargy is part of B sharp. It's a neurological problem. The kid is dehydrated and is lethargic. So 1 is wrong, 2 is wrong, 3 is wrong. The right answer is number 4. Sleeping quietly should be. A 9-month-old should not be sleeping quietly after vomiting, having diarrhea, couldn't take anything. His heart rate went up. All of a sudden, he's sleeping quietly. He is in shock. That's why he's lethargic. So, number 4 is your right answer. And the last one. This is just to give you a concept you should know. This is a select or apply. Which of the following actions by the new graduate need immediate intervention? A nurse is precepting a new graduate in the pediatric ward. Which of the following actions by the new graduate need immediate intervention? Check rectal temperature in a 12-month-old with flu. Check rectal temperature in a 12-month-old with diarrhea. Check rectal temperature in a 12-month-old with thoracic or falling. Check a rectal temperature in a 12-month-old with leukemia, or check a rectal temperature in 12-month-old with fecal impaction. Select or apply. Which one you need to intervene? That means they're doing something bad. And like I told you, it's a concept. If you know the concept, this question is easy. One concept. One concept. So which of these 5 you need to intervene? Anybody, you should not do a rectal temperature on somebody with a diarrhea because it will lead to perforation. Somebody with a heart problem, vagal stimulation, and that will cause problem. Somebody with immunocompromised, leukemia, perforation. Somebody with fecal impaction. If you have a flu, we can check your rectal temperature. But 2, you should not do that. No diarrhea. Heart problem? No. Immunocompromise? No. And fecal impaction? No. Thank you for watching. 2 to 5 are your right answer. You need to intervene. Take care of yourself. Subscribe to Adapt NCLEX for more content like that. And join our membership. All the best of luck. Good luck in your exams. Take care. Bye-bye.